Well, hello, Mrs. Miller. My name's Amelia. I'm a nurse practitioner student, and I'll be providing care for you today. How are you doing?
I'm good. How are you?
Very good. It's nice to see you. So before we get the assessment going, I just want to go over a couple of health maintenance items with you.
Okay.
First, do you wear glasses or contacts?
Yeah, I wear both.
Okay. Do you get regular eye exams?
I do.
Okay. When was your last eye exam?
It was 2 weeks ago.
2 weeks ago. Did everything check out okay?
Yeah, it was good.
Good. Do you feel like your prescription's the right one for you?
I think so, yes.
Okay, wonderful, wonderful. And then in terms of vaccinations, it looks like you have had your meningitis vaccine, you're up to date on the Tdap, and you did complete the Gardasil series. So
correct, yes.
that's wonderful. Okay, well first I'm just going to take a quick listen to your heart and lungs.
Okay.
All right, you can breathe naturally here. And a few deep breaths for me. Okay, thank you so much, Mrs. Miller. Now we're going to begin the neurovascular assessment.
Okay.
First, we're going to test cranial nerve 1, which is the olfactory nerve. So I'm going to check your sense of smell in each nostril.
Okay.
So first, I want to check the patency of your nose, make sure you're able to breathe in and out
Sure.
each nostril. So I'm going to plug one and have you breathe.
Okay.
Okay, very good. All right, since we know those are working, what I'm going to do is I'm going to have you plug one of your nostrils and close your eyes. I'm going to put 3 different scents underneath, and you're going to let me know what they are.
Okay.
And we'll do the other nostril, okay? So plug your right nostril first, okay, and close your eyes. All right, what's the first fragrance?
Cinnamon?
Okay, and the second?
Garlic?
Yes. And the third?
Coffee?
Wonderful. Okay, now you can unplug that one and please plug your other one. All right. And what's this fragrance?
Coffee.
All right.
Cinnamon.
Right, and one more.
Garlic.
Thank you very much. You can unplug your nose and open your eyes.
Okay.
So optic nerve number 2 is, or cranial nerve number 2 is the optic nerve.
Okay.
So I'm going to take a look in your eyes. I'm going to be looking at the fundi and your disc and making sure disc edges are nice and sharp. Everything's nice and clear. All right. Next we're going to test for confrontation.
Okay.
So what I'm going to have you do is look directly at me. I'm going to have my hands out and you let me know which hand is moving, okay?
Okay. Right hand. Left hand. Right hand. Left hand.
Okay, very good. Thank you. All right, so cranial nerves 3, 4, and 6 will be assessed together. They're cranial nerves, the oculomotor, trochlear, and abducens. So I'm going to check and make sure that your pupils are reactive to light.
Okay.
So look straight ahead. Perfect. And that looks great. Okay, and next I'm going to check for any extraocular movements and test your cardinal vision.
Okay.
So follow my finger with just your eyes, not your head. And testing for convergence. Okay, thank you very much. All right, so next we have cranial nerve number 5, which is the trigeminal. So I'm going to test your ability to differentiate between sharp and dull sensations on your face.
Okay.
So I'm going to have you close your eyes and you let me know if it is sharp or dull.
Dull. Sharp. Dull. dull, sharp, dull.
All right, thank you. You can open your eyes now. And I just want to test the strength in your face here.
Okay.
So I'm going to have you clench your jaw while I touch your temples and then by your jaw.
Okay.
So you can clench and unclench and clench and unclench. Okay, thank you. All right, so that was cranial nerve number 5. Now we're on to cranial nerve number 7, which is the facial nerve. So I want to see how your face moves. So
Okay.
Can you raise your eyebrows up and down for me? All right. Can you give me a big smile and a frown? Can you show me your bottom teeth and your top teeth and puff your cheeks out? Perfect. Thank you. The next one's going to be a little weird, but I want you to try to close your eyes as hard as you can, and I'm going to try to open them, okay? All right, perfect. So good strength there. I wasn't able to get them open. All right, so that was number 7. Number 8 is the acoustic nerve. So I'm going to test your hearing.
Okay.
So I have a tuning fork here, and I'm going to perform the Weber test. So I'm going to strike the tuning fork and put it on your head, and you let me know if you hear more in one ear or the other, or the same in both.
The same in both.
Okay. Now I'm going to test your hearing using the Rhine test.
Okay.
So I'm going to hit my tuning fork again and put it on the bone right behind your ear. Let me know when you hear it. Stop hearing the vibration.
Now.
Okay? And again, when you can stop hearing.
Now.
Okay, thank you. Then we're going to go over and do it on the other side. Okay, let me know when you stop hearing the tuning fork.
Now.
Okay, and again.
Now.
All right, thank you. All right, so now ocular nerve or cranial nerves 9 and 10 are the glossopharyngeal and the vagus nerve. So I'm going to take a look in your mouth here.
Okay.
And I'm going to have you say ah. And I assess that your uvula is midline, your soft palate moves as it's supposed to. Everything looks great in there.
Okay.
Okay, and now I'm going to assess your gag reflex, okay?
Okay.
All right, very good gag reflex. All right, so that was cranial nerves 9 and 10. Cranial nerve 11 is spinal accessories.
Okay.
So I'm going to check for your shoulder strength first. Okay, so I'm going to have you push up against my hands. Perfect. And I feel that your muscles are symmetrical and everything looks good there. Okay, next I'm going to check your neck strength.
Okay.
So I'm going to put my hand on your face and you're going to try to turn your head against it. Okay? All right. Perfect. Thank you. And then cranial nerve 12 is the hypoglossal nerve. So
Okay.
I'm going to assess your tongue here. If you can open it up
Okay.
and move your tongue side to side and up and down for me. Okay, looks great. Thank you. All right, so now I'm gonna test your fine motor skills.
Okay.
So I would like you to move your hands and then flip them over and do that as fast as you can. Perfect. And then with your feet, I want you to take the balls of your feet and kind of stomp as fast as you can. Perfect. Thank you. Okay. So next I want you to stand up.
Okay.
I'm going to have you face me.
Okay.
And we're going to do the Romberg test to test your balance.
Okay.
So you stand with your feet together and then close your eyes. And I observe for about 30 to 60 seconds and I see there is no swaying and you have good balance. All right, next I am going to have you open your eyes.
Okay.
And I'm just going to assess you as you walk, watching your gait and your posture.
Okay.
So just going to move out of the way and I'll have you walk back and forth. Right, and then to the chair. All right, perfect. Thank you so much. And now you can sit down.
Okay.
All right. Now we're going to do some sensory perception tests.
Okay.
Okay. So the first one It's kind of like the one we did on your face, you know, is it dull or sharp? But I'm going to do that on your extremities, on your arms and your legs.
Okay.
So again, I'll have you close your eyes and you let me know if you feel dull or sharp.
Okay. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay.
Sharp. Dull. Sharp. Dull.
All right, thank you. All right. So next, I'm going to test your perception of position. And to do that, I'm going to move your toe,
Okay.
and you let me know whether I'm moving it up or down, left or right.
Okay.
Okay.
Sounds good.
Might not be able to see this. Okay.
Down. Up. Left. Right.
Okay.
Down. Up. Right. Left.
Okay. And then next, I'm going to be testing your perception of vibrations
Okay.
on joints and bony promises. So I'm going to start with your toe
Okay.
using my tuning fork, and let me know if you feel the vibration.
Yes. Yes.
All right? And then put your hands out like this for me, and I'll check. Let me know if you're feeling the vibration.
Yes. Yes.
Okay, thank you. Okay, so next I'm going to test your ability to identify objects that I place in your hands.
Okay.
So I'm going to have you put your hands out with your eyes closed.
Okay.
All right. So let me know what this is.
Coin.
All right.
Paperclip.
Okay.
A key.
All right, perfect. Now we'll do the other one.
Paperclip.
Yep. Whoop.
A coin.
Okay.
A key.
All right, thank you. Next, we have something called the 2-point discrimination test.
Okay.
So I want you to let me know if you feel 1 or 2 sharp points.
Okay.
I'm going to do this on the pad of your finger.
Okay.
So put your fingers out.
Okay. 1. 1. 2.
All right. Thank you. Next, I'm going to test your ability to identify something that I draw on your hand.
Okay.
Okay? So close your eyes again.
Okay. A 3.
Okay.
An X.
Perfect. Okay. And then the last test, like this one we're going to do, I'm going to ask you to identify where I'm touching you while your eyes are closed.
Okay.
Okay?
Sounds good.
So you close your eyes and let me know what part of your body I'm touching.
Okay. Right arm. Left knee. Left arm. Right foot. Left calf. Right shoulder.
Perfect. Thank you. Now you may open your eyes, and I'm going to assess deep tendon reflexes.
Okay.
So the first one I'm going to do is your abdominal reflex. So I'll have
Okay.
you lay down for me, please. All right. And is it okay if I just lift up your shirt a little bit?
Yeah. Yeah, that's fine.
Okay, it might be ticklish here, but
Okay.
Okay, appropriate reflex. Appropriate. All right, appropriate abdominal reflexes. Next, I'm going to assess your plantar reflex here.
Okay.
Okay. Perfect, thank you. You may sit up again. Right, so now I'm going to assess your bicep,
Okay.
your tricep, and then your brachial radial
All right.
reflexes.
Sounds good.
Okay, so I'll do your bicep first,
Okay.
right, and then I'll do your tricep. All right, and then, excuse me, brachial radial. Thank you. And come do it on the other side.
Okay.
Right, bicep. Right, tricep. And the brachioradial. All right, thank you. Now can you sit back a little bit so that your feet are dangling? Thank you. I'm going to check your patellar reflexes.
Okay.
Perfect. Perfect. Okay. Next we'll do your Achilles reflex. So, I'll just have you, all right, perfect. On your back of your ankle here. All right, and then assess for clonus. Okay, I'm holding your leg up here. Do you feel anything weird, pops, clicks?
No, it feels okay.
Right, yep, and perfect. Try to relax your leg. Okay, all right, thank you. Well, Mrs. Miller, it's been a pleasure working with you today. You take care now.
Thank you. You too.
Thank you.